vaping and Juul pods. What does this all mean? Kids today are now picking up something that has 21 grams of nicotine in it. With me to help figure out what this is all about is Bob Collette, your Director of Cape Cod Regional Tobacco Control Program. That's a long title.
It is a long title, and I know we could have had something more brief back when we started in 1994, but this is what we went with.
Right, so the Regional Tobacco Control Program runs out of the county. Give us a little brief history of what your program does.
Our primary focus is public education and education of local stakeholders such as boards of health, town councils, boards of selectmen, and so forth. And also we provide policy development for them and technical assistance in that regard. And so we've helped all of the local towns and municipalities across the Cape and Islands and beyond during the time that we've been in existence with development of tobacco policy relative to youth access to tobacco and also protecting the public from secondhand smoke. And then now we also enforce those regulations for the local towns.
Right. So this is, broad-reaching. Years ago, it was just tobacco, but now there's flavored cigars, and then the Juuls. So the county got a $122,000 grant from the state this year at the end of their budget season to do what?
Well, what we will do is to continue the efforts that we've been making in fighting the tobacco industry, which targets our youth in a very direct way. They spend about 95% of their marketing dollars directly targeting our 14-year-olds, so kids that are in middle school. And as a result, while the work that we've done over the years has resulted in a precipitous reduction in the use of cigarettes among kids, and that along with gradual incremental increases in price of cigarettes have put them out of reach of most kids price-wise. So that's not the cool thing to do anymore. But the new cigarettes is a product that we have called Juul, and this is one of many devices that kids are using now, and they can do so in a very much undetected way. And if you take a look at this, it sort of looks like a flash drive.
Right.
And these are battery operated. So you take the battery, you can recharge it in the computer at home. Kids will have this in their bedroom or at the school library or classroom. They can plug it right into the sides of their computer and recharge it and go ahead and use it. And the way it works is that the user will puff on this, which activates the battery, heats a nicotine liquid that's inside it, and then it creates an aerosol that the user inhales, and they come in many flavors such as straight tobacco, creme de menthe, fruit, mango, creme brulee, and so it's very attractive to the young people. Right. And it's also the fact that it's so easily used without detection that they love it because they can sneak it in school. They're using this right in the classroom, in the hallways, in the bathrooms, any nook and cranny they can find in the school. And they take a quick drag off of it. They can conceal the vapor that they exhale. It dissipates very quickly, and unless you're right as close as we are, you would never even know that the person is using it.
So let's really talk. This has huge health implications. I read that one of these small little pods
Yes.
can have up to 21 grams of nicotine in it?
Well, some of them do. One of these pods, and these are the pods that are inserted into the Juul unit, does contain the same amount of nicotine as a package of cigarettes, and that's clearly stated right on the package. And the trouble is that people who are using this, the kids especially, will sometimes consume an entire pod in as little as an hour or an hour and a half to 2 hours. And so if you think about that in terms of the amount of nicotine that they're taking in, keeping in mind that nicotine is an extremely toxic chemical, they are in essence consuming the same amount of nicotine in 1 hour is the equivalent of us taking a package of cigarettes in that time.
Nicotine's highly addictive.
Yes.
So a kid who has been peer pressured to pick this up once
Right.
could probably become addicted after their first use of this.
Right.
Whereas cigarettes, sometimes because of the nasty taste or the smoke or the after effects of the other chemicals in cigarettes, might not pick it up again. But this seems like
Exactly.
very nefarious.
It's a little milder than a typical cigarette would be, for instance. You're right. So it's more palatable, easy to tolerate. Typically, nicotine addiction takes about 2 weeks to develop in most users. And that's why the industry targets 14-year-olds that are really unable to make rational choices about what they're going to do with their lives. They're very uncertain of themselves and vulnerable, transitioning from the 8th grade into the 9th grade, into high school, and trying to figure out, they want to be part of a group. So if they have the perception that everyone is doing this, then they're very likely going to try it themselves. And it's going to make me look cooler, tougher, sexier, whatever, at that age, and the kids are so uncertain. And their perception of this, we just was at a school yesterday speaking to staff, they related to me that when they spoke with their incoming freshmen a couple of days ago, they reported they thought that 95% of kids use this, which is not anywhere near accurate. It's more like 25%, but 40% of kids report in the Youth Risk Behavior Survey that just recently was done, they reported as ever having tried it. So that number exceeds the highest smoking rate that we have ever seen among youth back when I was in high school in late 70s, early 80s.
Right.
And so it's very concerning in that regard also. So we're talking about something that they're using now at a greater rate than anybody ever used cigarettes in this country. But so the kids think that a lot more people are actually using this, and that's
Right.
common among them.
Right.
We've found that to be the case, because if they think everybody else is using it, then they're more likely to as well.
Right. So the Cape Cod Regional Tobacco Control Program comes into the schools to help staff and teachers understand how to deal with this?
Yes, over the past 9 months in particular, we've received numerous requests and have given many, many presentations to schools across Cape Cod and beyond the islands, to most often to teachers, other school staff, the school nurses, administrators, and so forth, because this has been a problem that has just recently emerged. These products have only been on the market for about 11 years now, and the use of these has increased by 900% since 2011. And I think of that 900%, about 700% has actually happened in the past 2 years. So the kids are using this, and we're sort of behind the curve as adults. I think this is going on, and then all of a sudden they sort of exploded on the scene, especially with the Juuls,
Right.
in the past couple of years. And so the teachers and the school administrators have been confounded as to how to deal with this in their schools.
Right. So let's talk, there's names here. There's Juul, the Juul.
Yes.
There's e-cigarette and vaping.
Vape.
All of them are the same?
Yes, vape pens, Juuls, e-hookah, it's all the same classification of devices. And they're sold for as little as $4.99 in the local store for disposable type units. And so those are one-time use. You use them, whatever nicotine is included in that, and you throw it away. The Juul, you buy these, a starter pack costs about $50 for one of these and 4 pods. And then you buy the replacement pods for anywhere between $15 and $20. So you make a larger initial investment, and a lot of times it's out of reach for one kid. So a group of kids will pool their money and have somebody purchase this. And unfortunately, we still have some towns on the Cape where the legal age to purchase any nicotine delivery product is still 18. So the high school seniors, many of them are very enterprising. They've established great little businesses for themselves with their 16, 17-year-old peers and younger kids in buying these for them. They'll charge them more money than what they actually cost, of course, so they're making their own commission tax-free
Okay.
right into their pockets. The other, the other two major sources of these is that they're available online, and so any person, the age verification online is, are you 18?
Right.
And you just check the box, and then they'll mail it to you. So kids are, they go out and buy gift cards, or if they received gift cards for holidays or birthdays or what have you, they turn around and use them to purchase these. Most of the time, these arrive on the doorstep before mom and dad get home from work, and the kids are home from school at, 2:30, 3 o'clock or so. So that it's easy for them to get. And then, unfortunately, one of the other sources, and I've eyewitnessed this myself on a couple of occasions while speaking with retailers right in the store setting, is that parents are coming in to buy this stuff for their kids. Everybody should know that this stuff is absolutely not safe. Right. It's not harmless. That's a widespread misconception. These do contain, again, nicotine. They also contain some chemicals such as propylene glycol and diacetyl, and some heavy metals, and we're starting to see some emerging health issues that have been associated with this. We don't have longitudinal data to show what long-term use of these causes with people, because they've only been out on the market for a while, and at the beginning there weren't that many users. So it's going to take some time, but we do know that diacetyl, for instance, causes a condition called popcorn lung.
Yep.
And that's characterized by holes in the air sacs and a calcification of the lymph nodes in the lungs. And it's a very dire condition. And it was linked to the diacetyl, which is which contained in these, through a study of people who worked in popcorn factories where they make microwave popcorn, and they use the diacetyl in that the chemicals that they use to make that. So those folks who have been exposed to diacetyl were coming down with this same condition, and so that's how we know that.
It just blows my mind that these, again, are marketed towards children. This is not a marketing scheme for adults in their 30s, 40s, and 50s. This is literally to get that youngster hooked on a product that is believed to be benign.
Exactly, and every tactic that they use it's right out of the tobacco industry playbook. And so they are, now you might hear radio ads by this particular company saying, these are not meant for kids. So what's the message to kids? Yeah.
Let me get some, right?
These are for you, let me get some. So, yeah, absolutely. And what they're targeting your 14-year-olds, knowing that once they addict somebody, which again only takes a couple of weeks, they have a customer for an average of 20 years. So it's all about the money for that. They really don't have any concern about the kids or their welfare.
Right. So I know that your program does some enforcement. You can come in and make sure that age verification is working, that the product is behind the counter so kids can't access it.
Correct.
What tips do you have for parents to combat this?
Well, they just need to be very aware of what's going on, and as they have to be with everything. Right. And so the problem with these is that it's not what you might call your usual suspects that are using this. Usually in a high school, for instance, you would have a group of kids that you would say, okay, yeah, those are the stoners. These are the kids that smoke cigarettes. These are the... No. This transcends all social groups in the high school. So you're talking about the kids in the key club, the chess club, the captain of the basketball team, athletes, the girls' swim team, everything. Football players, I was at a high school yesterday, again, where the principal related that during last fall, when fall football and soccer practices were starting before school even started, the kids were drooling right outside in their pads and their soccer uniforms getting ready for practice, not even realizing that it's full of nicotine and against school rules. Just laughing about it.
Respiratory, you're putting aerosol, you're inhaling aerosol back into your, at this point, lungs still developing.
That's absolutely correct. And they advertise it as a harmless vapor, but it's not a vapor, which sounds very benign.
Right.
It's an aerosol which the human respiratory system is not designed to handle.
Right. Well, this has been an education, Bob. You know, I think parents just need to ask their children, what are they doing with these products, or not to buy them for them either.
Right, and just be aware of
What it looks
these
like.
things. These look like a flash drive.
Right.
The kids, they're very easily concealed. They put them in their pockets. The girls will hide them wherever, that they can't be checked in school. And it looks like any other computer component that you might
Right.
have on your desk. You just have to be really careful and vigilant about things. And talk to your kids. You have to be straight with them. Start talking to them when they're very young.
Right.
And that's the time to get them. And middle school, the kids are really, really vulnerable. And it's a great age to really talk to them when they're about 11 or 12 years old and they're starting to be aware of their surroundings and what's going
Right.
on. And when they enter middle school, they're going to start seeing this stuff.
Right.
And these are being used at the middle school level.
Right.
We're hearing reports from here in Barnstable.
Well, the first one's $4.95. Geez, that's a weekly allowance or a daily allowance for
Yeah.
some middle school kids. So,
Right.
it's accessible.
Yep. And then there are those disposable ones and so forth. Some of them will look like eyeliner or lipstick. So just don't assume that it's something that is in your child's backpack or sitting on their bureau and
Right.
them thinking that you won't know what it is. Take a look at everything.
Right.
And most of all, most importantly, talk to the kids about it. Talk to your kids. And the parents need to know this stuff is not safe. There's some evidence that it's probably safer than cigarettes or other forms of tobacco. But again, they contain nicotine. It's a very dangerous and toxic chemical.
Exactly. Well, thank you so much, Bob. I really appreciate the information, and I know our parents will. Parents, check your kids' backpacks, dressers, things that look like little components, really literally could help save your child's life someday.
That's true.
Thank you, Bob. I appreciate
Thank you,
it.
Paula. Nice to have you here. Thank you. Bye-bye. All right.